Generally, it's not a concern, but if you are especially following the instructions, which we discussed before, that give a little bit of a time between retainer wear and the application of the teeth whitening gel. Also, do not apply directly onto the retainers. If you're following instructions, it should not, but prolonged use and prolonged exposure onto the whitening agent may cause some discoloration over a period of time. Sensitivity can occur. It's common, but if it persists for a long time, and it should go away after the application of the teeth whitening gel. But if it exists and it persists, then I would recommend stop the usage of the whitening agent and consult your dentist as soon as possible. I would avoid on teeth whitening on children. And if there is a specific concern, I would recommend that you talk to your dentist before using this on children. Uh, it's not a safe procedure for them. It's not recommended for kids. Thing for that is comparing your before and after pictures, or comparing it with a shade guide that usually comes with the whitening pens or whitening kits. So you can just compare that what shade was it before you applied the gel and what shade it is after you have completed the treatment. Yes, that is very, very important. Number one, you that will give you an opportunity to discuss with your dentist about the whitening options, and the professional cleaning basically removes all the stubborn stains and the tartar buildup, which might affect the outcome of whitening uh, gels. They don't. It's just a gel that is applied on the tooth directly, and there's no use of laser in these pens. Best thing that you can do is follow the instructions of the product. Okay, and all the avoid foods with very strong colors. Smoking, coffee, and all these things can cause stains also. So avoiding foods that can stain your teeth is also very helpful. And following the instructions and keeping your teeth clean will give you the best results. Yes, but make sure that you rinse your mouth really well when you apply teeth whitening gel on your teeth. Um, they should be dry, and avoid touching the whitening gels to your gums and lips. Also, if you have those abrasive stuff in your toothpaste, make sure that your teeth are thoroughly clean. So do not apply if there are some debris on your teeth, because that might interfere with the outcome of the results. No, it will cause irritation, and in some cases can be serious. It's hydrogen peroxide. It's a very acidic material which can affect the soft tissue. So you should avoid touching it to your lips and gums. If it's a very small amount, uh, it it is it might be safe. But if you start feeling any symptoms or if you're concerned, I would call the poison control right away and call the physician or go to the ER. They are effective in removing common stains and mostly the superficial stains. If there are severe discoloration, that may require some professional treatment for optimal results. And they're not designed for something intrinsic stains or some very stubborn stains. So for that, you have to consult your doctor. Yes, severe discoloration or stains may require multiple treatments or even professional intervention. So, again, if you have very severe discoloration, I would recommend talking to your dentist before applying any teeth whitening products on your teeth. Yes, teeth whitening treatments can significantly reduce stains from smoking and coffee consumption, but results may vary depending on the individual factors. Uh, if you're not seeing too many good results, uh, contact your doctor and discuss different options with them.